Welcome to the Country Education Partnership Pre-Professional Development Autumn Series. My name is Brendan Ryan. The Country Education Partnership acknowledges the traditional owners of country throughout Australia and recognises the continuing connection to lands, waters and communities. We pay our respect to Aboriginal and Torres Strait Islander cultures and to elders past and present. Welcome everybody to the fourth session in the winter series. Today's topic, managing anxiety and secondary school trauma in schools. It's my pleasure, as usual, to introduce the Chief Executive Officer of CEP, Mark McLean. Over to you, Mark.
Thank you, Brendan. Fantastic. Looking forward to today's session. Latest news in Country Education Partnership world. We had our gala dinner and AGM and forum last week, which was very well attended, and people can head to our socials for all the information on those sessions. We also have our New Zealand educators trip planned for August. That trip sold out in 2 days from when it went live. And we had our New Zealand host with us in Melbourne last week. So that was also very exciting, and those participants are looking forward to that. We also had a special recipient of a prize who I was hoping might be on this session. So I might leave that to the end, Brendan, in case he joins in.
Very good. Thanks, Mark. Our normal housekeeping will apply. This is a 1 hour session to conclude at 5 p.m. The program is being recorded, so the program can be reviewed at any time online at your convenience. Past sessions are also available for those that would interest in some of our previous sessions during the winter series. Anyone who has a question, please include the question in the chat box. This will be checked during the session, and we will endeavour to answer all questions before the conclusion of the session. And a reminder, please complete the short survey at the conclusion of the session before signing off. That's very important so that we can get the feedback regarding how the session has been going today. Mark, you're waving?
Yes, our special announcement, which I can now do. On Thursday night, we announced we had collated our data over 2 years worth of PD Online series, looking at attendees and cross-checking it with those present at our education dinner to see who in the room had attended the most PD Online sessions. And they were the recipient of a lovely dinner. And that was Damien Lappin from Locksport Primary School, who's in the room today. So congratulations again, Damien.
Well done, Mark.
That's it, Brendan.
Okay, thank you. So I'd now like to hand over to CEP Manager Morris Billy, who will introduce our guests and facilitate today's session. Over to you, Morris.
Thanks, Brendan, and hello, everyone. And what a fantastic session we've got lined up for you this afternoon. I think as a number of CEP staff members have been travelling around the state this year and last year, one of the issues that has come up constantly in our discussions and constantly with education providers has been the increasing prevalence of anxiety and anxiety disorders in the classroom, and the impacts that has on young people, families, schools, parents, in fact, the entire community. So we've got the who's who in this particular space coming up this afternoon. We'll be hearing a bit later on from Adam Fraser, who we've had the privilege of being with us previously on one of our PD Onlines, and Adam will be joined by Adam Downs. So we've got a double dose of Adams today. But first up, we're going to be speaking with Chloe Kidd, and Dr. Kidd is a postdoctoral research fellow with child and adolescent mental health for the Centre of Health Research. She has a PhD in clinical psychology. She is a psychologist, and she's also talking specifically to teachers today, highlighting some of the resources and the programs that are available through her work around online anxiety. So, Dr. Chloe Kidd, could I hand over to you, and look forward to hearing about your work and your presentation today.
Oh, thank you. That was such a really nice introduction. I'm so excited to be invited to come and talk to the educators that are on the ground working with these young people about a topic that's so near and dear to my heart, which is the mental health in our young Australians, and in particular, the mental health of our young Australians living in rural and regional communities. So hopefully a lot of the students who are part of your school community would fall under that banner. I hope, I mean, it's only 20 minutes or so, but I hope that by the end of it, you'll have a nice foundational kind of understanding about, mental health in that population, as well as, spotting kind of anxiety in the classroom, because sometimes it can be easily missed, and we'll talk about that in further detail, as well as some sort of tips and strategies that you can implement at your schools that might be able to help those kids that are feeling anxious and overwhelmed. And like what was mentioned, a lot of my research is in the digital mental health space, so improving the effectiveness of digital mental health interventions for kids in rural communities and regional communities with anxiety in particular. So I'm hoping that I have enough time at the end to introduce you to a free program that we've got going on as well that you can share with your school community as well. So I'm just going to share my slides, and hopefully we did a practice run through, so hopefully this goes easily. Can everybody see my slides?
Yep.
Yep, beautiful. Okay, so we'll jump straight into it. In what we know from a large kind of nationally representative study, they're estimating around 1 in 7 young people at the moment are reporting symptoms that would be consistent with a mental health diagnosis. So if we want to sort of zoom back a little bit, that's over 550,000 young people living in Australia right now that are reporting symptoms that are really clinically significant and distressing for them, and having a functional impact in their lives. So impacting their academic performances or impacting them socially, really getting in the way of them being able to live their life to their full extent. Anxiety disorders as a group are actually the most common psychological conditions that are reported in that 1 in 7. And unfortunately, what we do know is around 50% of young people with a mental health condition don't go on to receive the professional support that they need. And again, unfortunately, what we see in the research and what I've seen, time and time again in my clinical practice, is that the negative consequences of poor mental health in childhood will usually go on to persist. What we see is in adults with more severe mental health presentations that the good majority of them were experiencing poor mental health before the age of 14. So it really just highlights the importance of early identification as well as early intervention to sort of help those young people learn those skills when they're young, to reduce the burden of mental health when they get older. Zoning in on that regional and rural sort of scope as well, when we look at the data, what it's actually suggesting are the rates of poor mental health is actually higher the further away that you get from the capital cities. So in particular for our young men, our young boys, they're reporting about 1 in 5. So they're reporting symptoms consistent with a mental health diagnosis. So that's quite concerning in terms of the rates of mental health. And if you look at smaller, even more recent studies, there is suggestions that those rates of mental health are increasing. And I'm sure that a few of you can probably relate to that in terms of what you're noticing in your own school community. Beyond just reporting symptoms for a mental health diagnosis, we've got around 25% of young people in rural and regional areas that are also reporting high levels of psychological distress, so are feeling very overwhelmed. So that's 1 in 4. So again, when you dig in deeper and deeper, we're seeing those rates go up and up and up. And it's been very well known for quite some time that the further away that you get from the capital cities or the big cities, the further away further that you get into rural and remote communities, the higher the rates of suicide and risk-taking behaviours are as well. So I guess it paints kind of a grim picture, but there's certainly some reasons as to why we're seeing higher rates in those communities. In particular, this is by no means like an exhaustive list of all the risk factors that would increase people's risk to developing a mental health concern. They're just probably the most common ones that you might come across within school communities. In general, any kind of exposure to trauma or adverse life events like parents getting divorced, or if they're with the defence and they're having to move towns, often can raise risk. Things like co-occurring neurodevelopmental conditions like ADHD and autism increase people's risk for mental health. Bullying, of course, and our First Nations peoples are all at greater risk for mental health. It doesn't guarantee that they're going to go on and experience psychological distress or develop a condition like anxiety, but they're just flags for you to keep an eye on. So if you know that your students are going through something like that, just to keep an extra close eye on them. In terms of the regional and rural context in specific, there's additional risk factors that are really unique to those areas. So there's geographic isolation. So if our young people are living out of town on a farm, it's like 40 minutes to the nearest town, that creates a real risk. And certainly once we go more rural and remote, financial concerns are more frequently reported. And those two together create a real barrier to being able to just access treatment for mental health support. If you have to drive 40 minutes into town to see a psychologist once every fortnight for the next 16 fortnights, and doing that is not cheap in itself, and I can say that as a registered practicing psychologist, it's going to create a real barrier to those families getting the help that they need to support their young person. And then on top of that, in rural and regional areas, the workforce of trained mental health clinicians is smaller. So the further away you get from the cities, the less people there are available to actually help. So you've got this real kind of mess of barriers that are really contributing to the greater risk of poor mental health in young people in these communities. So just something to keep in mind there. In terms of mental health within the school community, I'm sure it comes as no surprise that there is quite a well-established link between mental health and academic performance. And it's often in the school environment where that's one of the first indicators that something might be off for the students. So you might actually notice that there's a dip in their academic performance before we realize that, hey, there might be some mental health going on. But what I always try to encourage people to do is actually dig a little bit deeper and try to understand the connection between mental health and between academic performance, because there's often a lot of things going on under the surface there. Certainly when young people are struggling with really high levels of anxiety and really high levels of depression, for example, that impacts their executive functioning, which is just kind of a fancy umbrella term for the cognitive processes in our brain that are responsible for things like memory, problem solving, decision making, the ability to sustain attention and concentration. And that is all impaired when you're reporting or also experiencing really high levels of distress. So it's no wonder that that would be linked to poorer academic performance, because they are struggling to concentrate on their work in the classroom environment. Another one of these things I like to always really tease out as well is students' psychological well-being. So if you have poor mental health, it often comes with things like low self-esteem, low confidence, and greater difficulty managing stresses. And so when exam blocks come into play and things like that, and there's a lot of stress involved with that, you're going to find that these young people with mental health concerns are going to struggle with that even more so than their peer next to them who's also stressed but doesn't have this extra anxiety or depression on top. The other factors there that can sometimes explain that relationship are difficulties in their peer relationships, behavioural changes, so not going to school as often or acting out in the classroom. Substance use can be common for the older teens as well. And then, of course, there's a link between your physical and mental health, that mind-body connection. So people who are struggling with their mental health are always going to be also going to struggle with things like fatigue and sleep, which is going to make it harder for them to concentrate on their schoolwork. So you can kind of, if you dig a little bit deeper, it's really important to understand what are the individual factors that are contributing to this young person having difficulty at school, so that any kind of intervention can target those ones in particular. This next graph I really liked because it really just paints a very clear picture about how mental health in general can impact students. On average, young people with depression will miss up to 20 days of school every year because of their mental health condition. Anxiety is not too far behind that. It's up to 12 days per school year. So that's, between 2 to 4 weeks every year that they're missing on school. It's no wonder that might actually impact on their ability to do well. In terms of teachers, I stole this title from a research article as teachers being the first responders. And I think teachers and educators, too often they're the first professionals to really notice when a kid is experiencing a mental health crisis. And what our research is showing on and on and on, again and again, and what Maurice also commented on, was that Australian teachers are asking for more training in mental health because they're recognising that it is a problem and they want to feel more competent in responding. In terms of what the research also shows us is that teachers are actually really good at noticing the more severe mental health presentations, as well as externalizing conditions like hyperactivity symptoms or conduct and behavioral problems. What's harder to pick up, though, is the more mild to moderate symptoms that are not quite as obvious, as well as those internalizing conditions like anxiety, because it sort of goes inwards rather than outwards with some other conditions. So keeping with that anxiety, sort of in that anxiety space, rather than going through all the different disorders, I thought it actually would be more helpful to break it down into the core manifestations of anxiety, so to speak. And these are kind of transdiagnostic. So you'll see this across lots of different types of anxiety. Physically, it's the kids that complain of stomach problems or headaches, who need to go to the sick bay often or to the toilet often. If there's no medical reason for that, there's quite often it's because they've spent all day worrying and their little bodies are so tense. Cognitively, you'll see a lot of negative self-talk and a lot of what ifs, like what if something bad happens, and then what are we going to do if that happens? And it'll just keep going and going and going. Psychologically, again, you'll see the kids that are very low in confidence. They need a lot of reassurance from their teachers and from their principals that everything's going to be okay. And behaviorally, why kids with anxiety often get missed is because they're often the ones that are really, really well behaved. Because part of their anxiety a lot of the time is they don't want to make a mistake. They don't want to get in trouble. They want to do really, really well, and their perfectionism tends to play into that. And so they're the easy kids, right? They're the ones that are doing really well, but inside there's a lot of turmoil. So I just be mindful, I suppose, of if you're noticing that they're very good or very worried that they're going to get in trouble for something. And then on the flip side as well, it's also the kids that sometimes can't sit still and are fidgeting a lot because they've got a lot of that restless energy. I wish I had more time to speak about that, but I'm conscious I don't want to skip anything too important. These are just some evidence-based classroom strategies and accommodations that you could consider including within your school community. There may be stuff that you're already pretty well aware of, but all of these are really great for anxious kids, especially the first one about praising the effort and not the outcome. Again, they can be so fixated on, I have to do well, otherwise something bad will happen if I don't. We need to draw their attention to the effort rather than the outcome of those assessments. So saying things like, wow, I can see that you worked so hard on that story, well done, rather than well done on getting that A. And that really fosters that growth kind of mindset as well. Normalizing mistakes too, so verbally saying to them mistakes are a normal part of learning, and it's okay to make mistakes, and that's how we learn, and just really emphasize that so that they don't internalize those mistakes to mean something bad about themselves. Mental recharge spaces in classrooms are really good, and really encouraging kids to use that even if they don't look overwhelmed. Just make it a normal part of the school curriculum. Movement breaks, fidget objects are great for kids who are very restless. Of course, also great for our neurodivergent kids as well. Incorporating some breathing and mindfulness throughout the day, even just 2 or 3 minutes after the lunch break, can make a world of difference for learning those skills. And then, of course, modeling how you use those coping skills during the day is really, really important. Referrals to external partners is a really good idea, like GPs and pediatricians and counsellors. But I do want to make sure just to touch on digital programs for support as well. I think I've got a couple of minutes. Just interrupt me if I run out of time, guys. So keeping in mind with the rural and regional communities, you've got isolation, financial concerns, and a smaller workforce that's creating that barrier to treatment. So digital programs can really offer that alternate access to quality care in a timely manner. And there's a lot of growing programs, especially for anxiety. There's been decades of research to say that it can be particularly effective for these kinds of conditions. So it just kind of provides another accessible referral option when you're talking to parents and students about what they can do to overcome their struggles. Where I work at the Uni SQ, we've developed this kind of free digital mental health platform for kids and teens, particularly for those that are struggling with anxiety and depression. And it was developed with young people alongside us. So it was a really, really collaborative project. And it's completely free and all evidence informed, and anyone in Australia can access momentum for help, especially if they're not able to get in to see a face-to-face counsellor, or maybe they're too nervous to take that step. Momentum is a really great stepping stone towards getting the help they need. In particular, the program that I've been working on quite closely this year is a special anxiety program just for our rural and regional teens and kids. It's a 7-session free online program that they do on their own or with their parents online, but we've included a little bit of extra therapist support, keeping in mind that there's not a lot of therapists to go around, so that therapist support is by email, SMS, and really short consultations, and it's designed specifically for those kids in regional areas. And basically from this, what we really want to know and what we want to understand better is what actually works for regional and rural families. So we're gathering feedback all the time from the kids, the families, from schools about what works and what doesn't, so we can keep improving momentum. That's just an example of what the program actually looks like. You know, they learn all about their anxiety, some of those tips and strategies I was talking about before. It's all based in cognitive behavioural therapy. And yeah, I guess we're just kind of really trying to get the word out at the moment. I've been contacting a lot of students or a lot of schools to see if they could help us with promotion as well. So you're always welcome to pass my details on about momentum to students and families that you think might benefit from such things. Okay, hopefully I haven't gone too far over time. I've just stopped sharing my screen. Where am I?
You haven't, Chloe. And we've got a few minutes for questions and stuff as well before we hand over to Adam. But just a couple of things sprung to mind for me as you were going through your presentation, and you highlighted the challenges that rural and remote schools and students have in terms of even equality of access of services where there often isn't. There's a challenge in recruiting health professionals to come out to a lot of our rural areas as well. Even though schools occasionally have access to health professionals, they can't always get them and keep them. But I think this move into the online space to provide support for students, particularly with anxiety, where it's a big stretch, is something, and I'm glad you brought it up because it's something we probably need to promote and focus on going forward. Because even in my world, talking to a lot of young people, the challenge of meeting face-to-face is a big struggle, and we might get there, but the online world is probably a safer, clearer space for them early on. And now that we're starting to develop some stuff to match that, I think that's really important work. Is that what you're hearing and finding, I'm asking?
Yeah, absolutely. I completely agree with you. And I often say to my young people and the people that I work with in my clinical practice is that if COVID gave us anything, they made us more comfortable with the digital intervention and accessing healthcare digitally. You may have heard of the Brave program, which is another anxiety program that's been around for a very long time. It's the same researchers who developed that who have gone on to develop Momentum. Certainly, it's always great to be able to see someone face to face for your treatment if that's what you need, but it's not always feasible in practice, and it's not always feasible to see someone as consistently as you need to be able to recover from an anxiety disorder or another mental health condition. So, professional bodies and the government are even now recommending digital programs that are evidence informed to help fill that treatment gap and also act as a bit of a therapy adjunct for people who can't necessarily access the care that they need in a timely manner. Yeah.
And just quickly, the resources and ideas and suggestions that you had about classroom practice, which I love because they're so practical and they're great, without wanting to isolate anyone, but I often find, having spent time working in a number of school environments, that those strategies are more likely to be implemented in primary schools, more challenging in secondary school settings for a whole range of reasons.
Mm-hmm.
And I'm just wondering if you've got any advice for specific secondary school teachers who find it really difficult to find time to put those resources into place.
Oh, I completely agree with you. It's much easier when you've got the same kids every day and you've got that dedicated classroom space for them. Um, it's tricky. I think it's, if I really were to look at it, I think it would be a whole school approach to some of those that, especially with a mental recharge space. I know some schools have a space where kids can go at any point in the day if they are feeling overwhelmed or they need a break. I know some schools have the privilege of having that extra space and it works really well for some kids. In terms of for teachers on the ground in their classrooms and they're seeing different students every hour on the hour, what I would encourage is just to choose one thing that's simple to implement. And to just focus on that for the term or for 2 terms and see what the impact that has on your kids. So it could be as simple as just really emphasizing that praise on effort rather than the outcome, or just really emphasizing that mistakes are okay. Or even if you've got you're teaching a back-to-back double English class after lunch, is that for the first 2 minutes, you'll sit down and do a Smiling Minds breathing exercise. And it takes a minute, it takes 2 minutes, and it just helps switch gears. And that's it. And then you can go on to your regular programming. It's kind of just choosing one of those things and doing it consistently. Yeah.
Yeah, excellent advice. Thanks, Chloe. Dr. Chloe Kidd there, who's given us some wonderful information. And again, if you've got any questions, pop them in the chat box, or we might have some time towards the end to get back to them. But I now wanted to hand over to Dr. Adam Fraser, who, as I said, has been with us before and is an excellent presenter, has some wonderful work and some wonderful research, and is going to be discussing the report around secondary trauma and on the subject of managing anxiety and secondary trauma in schools specifically. As I said, we've got 2 Adams. Adam Downs is also with us, and he's principal at Stockdale Road Primary School, which is a professional learning community, and they're doing some wonderful work in that space as well. So first of all, I'll hand over to you, Dr. Fraser, and welcome back, and look forward to hearing some of your more recent findings in this space.
Excellent. Thank you. Thanks very much. Good to see you all. I'm just going to share my slides up. Here we go. So what I'm basically going to present you is a study that we've just completed looking at the impact of secondary trauma on educators. Now, what started this was we run something called the Flourish Movement, which works with school leaders around how do they be more effective but also sustainable. Adam Downs, who's on here, has completed Flourish in the Victoria group. And when you work with them so deeply, school leaders, you start to really hear stories and understand things. And I had a couple of school leaders share with me some stories about trauma that children had experienced. And it actually really affected my sleep. Like 2 stories that they told me, still even now when I think of them. And I just went, man, like I don't know that kid. I can't put a face to them. I don't have a relationship with them. And this is having that impact on me. Imagine what it does to them. So I started to look at the research around secondary trauma and what was out there, and very little was done in educators. There's a lot of work, and Chloe, you'll know this, is there's a lot of work in this for social workers, psychologists, health workers, but education was an area where the research just wasn't done. So we actually did the largest study in the world on this issue. Now, just right up front, one thing about research is it costs money, and we had some sponsors. So ASEPA were brilliant and really stepped up and helped us fund the research, as well as New South Wales PPA, the VPA and AGPA were secondary sponsors. We got a little bit of money from Deakin, who we did the study with, and then us as a company covered the rest of the cost of it. Now, in terms of methods, we did a survey that measured various aspects, and we're about to go through some of them. But we almost had 2,300 subjects, which is just awesome. And I do want to say a shout out to CEP. You guys really helped us out and you promoted this, and it was hugely beneficial. Now, what we also did is collected over 1,000 stories of secondary trauma, and we completed 107 interviews. Each interview went for about an hour. So, you know, the amount of research we did was very deep and intricate. And now we tried to partner with any of the departments that are around, and we couldn't get them on board. So this is something that is separate to them in terms of what we did. Now, if you look at, before I launch into the research, in terms of the demographics, we got really lucky. We got all sorts of roles that exist in schools. We had a mix of state, independent and Catholic. State made up the majority of them. We had every state and territory participate. This next one is particularly important for you guys. We had awesome representation from regional and remote areas. When we looked at this research, often you guys get left off that and has a metro focus, but you'll see you guys get a really great representation. Lots of different levels of experience and all different types of schools. Now, I'm just going to go over to my light board, just make sure, share. So just make sure that you can see me when I move over there. But I'm just going to go over some of the terms that you're going to need to understand for this presentation. So can everyone see me all right? Perfect. All right. So here's the first one. We've just had the Principal Wellbeing Survey come out. And obviously the thing that got a lot of attention in the media was the violence perpetrated against educators, which is obviously terrible. Now, that's direct trauma or first-hand trauma. What we were studying is a thing called secondary trauma. And that is where I don't witness or see the trauma, or the trauma doesn't happen to me, but I experience it vicariously through a child. So a child discloses or shares with an educator what has happened, and it's a traumatic experience. That educator experiences secondary trauma. Now, from there, what we get is a condition called STS, which is secondary traumatic stress. And that is the stress I go through when I'm made aware of that trauma. So secondary trauma stress, some people refer to it as compassion stress. Now, here's the other thing. So obviously you guys know about burnout. And what we know is that survey showed that workload is the biggest stress. So what we know is burnout is very prevalent in educators. Now, what the research shows is when burnout and STS come together, you get something called compassion fatigue. Now, when you fall into this, and Chloe, you would know much more about this than me, is when we fall into compassion fatigue, that's where the wheels fall off. Like your ability to have empathy. Chloe, you were talking about the educator is probably the best placed person to notice changes in behavior, signs of abuse. If you're in compassion fatigue, it's very hard for you to identify, those sorts of things, because you become very detached and your capacity to connect with other people. So these are the terms we're going to talk about today. Secondary trauma is I experienced it through someone else. STS is secondary traumatic stress. And when these two things come together, we're at risk of compassion fatigue. Cool? And at any point during this, if what I'm saying doesn't make sense or you want to ask a question, feel free to interrupt. And also you two, Ads, because I know you've done a lot of work in this area, feel free to interrupt me and talk about some of the things you've been doing. Cool. All right. I'm going to go back to my slides, and what we're going to start to look at is just some of the results. All right. Now, the big finding in terms of this whole thing is what shocked us is how dramatically the role of an educator has changed and evolved. Chloe, you talked about, them being first responders. From this report, we just said they've become the social workers of society. Like they are effectively, their role has shifted so much. The other thing that really stood out to us is just that systems are not evolving with this change. They're still going, what are your NAPLAN scores? If you're a high school, VCE or whatever, that's how they're measuring and looking at schools. But some schools are just dealing with so much well-being issues and trauma that, as one of the principals said, learning is a bonus right now. Now, the other thing we discovered is that most people don't recognize that this is an issue. And something that a lot of educators said is when we said, well, do you experience secondary trauma? They were like, well, what's that? Or do you experience secondary trauma stress? They didn't know it was a problem until we described it. And when we described it, they went, oh, yeah, far out. That is a big issue for me. So what is our concern is just how much schools have changed and how many hats educators are wearing today. All right, now, here's something I really want to show, and that is how do educators compare to other roles that have a lot of trauma or compassion or empathy in them. So that top number is the compassion satisfaction of the educators in our study. Now, I didn't put it up before, but compassion satisfaction is I support a child, I help them, and I walk away feeling really like happy with that. I'm proud of that. I made an impact. So basically, compassion satisfaction is how much joy do you get out of your job in terms of helping people. Now, if you look at all those professions that are there, they're pretty much identical. Mental health nurses was a bit down, but in terms of the meaning and purpose they get from their job, very similar. But when you go to burnout, you guys leave everyone else in the dust. I mean, 34% higher for educators than an emergency department nurse. And if you've been in an emergency department, you know how full on that environment is. Oncology, bereavement counsellors, social workers. What we're seeing is their burnout is nowhere near as high as what educators are. And when we look at secondary traumatic stress, our measure, everyone in that study scored an average of 27. Another study looking at teachers scored very similar, but the amount of secondary traumatic stress is so much higher for educators compared to, psychologists, mental health nurses. So what we're seeing is that, yeah, you guys get the joy from the job, but there's something in this dynamic where burnout and STS are so much higher. And I'm sure we'll talk about that in the questions that are coming up. All right. Now, I'm just going to go into some of the data. So the first thing we wanted to work out is this a problem? Do we have to worry about it? Now, to do a study, you've got to pick some outcome variables, and these are the outcomes that you do not want to have. So we went, if we look at the job of an educator, what are the things we don't want to occur? Now, rumination is where you go home, you stress, you worry, you can't turn off, you're thinking about work or that child, and you have that really unhealthy thinking pattern where you obsess about it. Mental health risk, of course, you know what that is, and likelihood of leaving the job. Now, first of all, we measured these things. Is rumination an issue? Absolutely. For the majority of educators, it is something that they go home and that occurs for them. When you look at mental health risk, the two you want to look at is the moderate and high. There's not many educators with very high because when they're in that category, it's hard to hold down a job. But if you look at moderate and high, that mental health risk for educators is significantly higher. And then likelihood of leaving the profession, these are the stats we gathered, which is similar to other studies where, if you include the undecided, you're looking at about 50% of the workforce are thinking, is this something I'm going to see through? Right, so that were the three things we didn't want. Then what we did is looked at how does these things linked to secondary trauma affect those outcomes we don't want. Now, when you look at secondary trauma stress, that is highly correlated with rumination, mental health risk, turnover risk. Like, you rarely see correlations that high. So the relationship between these two things is so strong. I mean, Chloe, you would know all about stats. Actually, you've probably repressed that. But like any correlation that's over sort of 0.3 is just huge. So what we know is this issue massively affects three outcomes we do not want. And what we also showed is just the majority of people do experience STS on a regular basis. Now, and what's really sad is one thing we collected is what is the trauma that's affecting our students the most? And it's those four things, which is just really heartbreaking. All right, now, when we look at burnout, similar thing. Burnout and its relationship to those outcome variables is so incredibly strong. I mean, 0.7, that's just nuts in terms of how high that is. So what we know is burnout rates are very high in educators and it's highly related with those three things. Now, this one's interesting. We also wanted to look at exposure. Does exposure, being exposed to trauma, affect those three outcomes? Very strongly it does, but not nearly as strongly as the stress that comes from it. So what we're learning here is exposure is important, but it's how that exposure affects you is much more powerful. And what I'm not saying here is that means, well, you educators better get better at dealing with that stuff. That's not it at all. Like so much of the system, whether you can get help. Chloe, you were talking before about access to resources. So many principals said, I spend half my day on the phone trying to find a service to support these children and I can't. And when they can't do that and they have to send that child home to an environment they know is not safe, that massively drives up their secondary traumatic stress. But what we take away is being exposed to it is powerful, but what's more powerful is how that affects you and your stress levels. Now, what we know is that in terms of exposure to secondary trauma, it is very high. Like, educators are being exposed to a lot of this. And the last thing we looked at was emotional demands at work. How do they affect? And what we showed, once again, really strong relationship. All right. Here's one thing I do want to say. We also measured, did that individual have a history of trauma themselves? So we asked the educators, do you have a history of trauma? And what we showed is their personal history of trauma does not affect these outcome variables nearly as much as them experiencing trauma through the child. So, this is how much it affects you. What we know is that individual trauma doesn't affect an educator nearly as much as secondary trauma does. All right, just one more thing here. Yeah, actually. Okay, so that's what we learn from this is, yes, it is a big problem. It's experienced, and it is one of the biggest drivers of mental health challenges and likelihood of leaving the role. Ads, did you want to weigh in on anything? I just feel like I know I'm giving you a lot of data here, but Ads, did you want to talk anything about that?
Yeah, thanks, Adam. I think, being a principal myself, and just it's great to hear, for me especially, I think that compassion fatigue, and that decision fatigue and that burnout, all the things that we deal with on a day-to-day place. And I guess, I've got a couple of questions. I don't know whether to do them now or next, but I think...
Yeah, I mean, if you got questions, let's do them in the question time. Because Morris, what time were you going to stop for questions?
We've got another 5 or so minutes with you, Adam.
Okay,
So
Okay, let me just go through.
Well, I think one thing there that you did say, Adam, was around the parents as well, and the parents, and we know that our systems aren't that healthy at the moment, those support systems, and just how we can. I just think that that everything that you've said and how we can look after ourselves and all the decisions that we make, not just around kids, but then we've got everything else that sits around the outside is a really important factor for principals.
Yeah, and look, I mean, one thing it does show is we've got to get this bloody workload issue sorted. For 20 years, I've been going to education conferences, and people are talking about, we've got to reduce the load on educators. I mean, obviously it's a big thing to take on, but it's so critical, because when you add that trauma and high workloads where people feel overwhelmed, I mean, that's when people really hit the wall. Look, just a couple of more findings I will share. Can you guys see that? Yep. So what we've shown is rural and remote, 15%, regional, 43% metro. So what was really good is we got to look at, different types of schools in terms of geographical differences. Sadly, and you guys know this, is that rural and remote schools have the highest levels of STS, burnout, emotional work demands, secondhand trauma. Then next to them is the regional schools, and then metro have the lowest scores. So very similar to what Chloe was saying before about mental health in children. So obviously this is an issue that is really important to everyone that's watching this right now. One more thing I will say is what we found is that the longer someone is in education, the more secondary trauma stress they accumulate. So it's almost like this stuff builds up in a person, and the more that builds up, the more of an impact it has. Look, I'm just going to very quickly cover what are some things that can help. Now, what we know is compassion, satisfaction. That's what I talked about before of, I help a child and I walk away feeling like I really made an impact and I really did my job there. So as you can see, it has a negative correlation with these things we don't. So the more compassion, satisfaction an individual has, the lower the chance of those three things. Now, in terms of support, one thing we looked at was, where are people getting support from? This was really interesting. So peers was the number one. And so in that column you've got here's how often I reach out, but also here's the level of satisfaction I have. So we can see that peers, personal lives, and then leaders. Yeah, that's probably because just an access issue. But when we interact with our peers or our leaders, we're very satisfied with the support. other areas, EAP scored the lowest in terms of satisfaction. Now, we're not bagging EAP, but what people just said is it's hit or miss. Sometimes I get a good person, sometimes I don't. Sometimes I spend the whole time explaining how a school runs, or I have a conversation, I call back, I get a different person, I have to go through the whole thing again. So just having EAP that's a bit more customized to school context would be really helpful. Now, one thing we did show is that how a leader responds is the most powerful support mechanism people can access. So when they do go to their leader, and if they get a good experience in that, it helps that individual so much. Look, the other ones that because I'm going to sort of end here, the other ones are around coping, and that is just your mental and emotional ability to cope. It's like your ability to not ruminate and worry, have self-compassion, ask for help. That's the coping piece. In terms of trauma training, this is really interesting. So this graph shows where there's gaps. So what's awesome is understanding impact on trauma. Only 13% of people said, I haven't done training on that. So that's really good, and adopting trauma-informed practice was really good. But here's what we know, is that doing trauma-informed practice does not help you deal with secondary traumatic stress in any way. And in fact, a group we've been collaborating with in Queensland showed that the more trauma-informed practice training you do, the higher your STS is likely to be. So where the gap is we've got to train people to be able to support themselves, support each other, and create a school culture where we can help process and manage these things. That's the big opportunity there. But the key takeaway is just because I've learned about trauma and how to manage a child does not translate into that helps me manage my trauma better. And then the last one is just recovery. And that is simply your ability to go home, disconnect, do things for yourself, have a hobby that distracts you. But these are the factors that we know really help this condition. So I'm going to leave it there just so we can hear from Adam, as well as grab some questions.
Thanks. Over to you, Adam. Have you got some comments that you'd like to share at this point?
Yeah, thanks. Again, and being principals on the page, I just think, and this is probably a question both to Chloe and to Adam,
yeah,
we're very good, I think, as principals, we put everyone else first, and we sort of look at that space and around, we deal, no doubt that we deal with a lot of things. And I love that bit around, I think what you were saying, Adam, we've got our students, and Chloe, you're that data that you presented there around students. We also deal with the parents that have obviously got their mental health concerns as well. And so therefore we just hit it doubly. So we've got students with it, and then we have parents with it. And I guess my question to both of you is around, I tell myself that I don't feel stress. My staff and my family tell me very different things that they can often tell, and I'm quite lucky that I've got a leadership team around me. But what are some of those signs of that compassion fatigue that we can start to notice in ourselves that before, so we can put some of those things and I think that what you had sort of said, Adam, around these are the great things, but when things do, when things start to pile up, we don't notice until it's too late. So what are some of those things that for us as principals that we can have an understanding about? What are the signs for us around compassion fatigue, the burnout, that decision fatigue that we're hit with constantly?
Chloe, do you want to start, being the registered psychologist on the panel?
Yeah, sure, no problems. I guess the signs, I suppose I'm talking from more of the compassion fatigue. I could imagine that it's very similar to educators. The warning signs often are overworking, fatigue despite getting a lot of rest. You obviously you want to have barriers between connecting emotionally and not connecting too much, because that can bring you at risk for secondary trauma. But if you're noticing that the empathy or the compassion is harder to tap into when you're speaking to a child or speaking to the parent, and you're getting more frustrated, can be a real indicator that you might be experiencing compassion fatigue or at risk of that as well. Would you say that that's what you've heard in your research as well, Adam?
Yeah, brilliant. And like Adam, the big one is that emotional exhaustion. Like in terms of, you can see that they're really struggling to engage. Probably the biggest one is we start to detach from people and we start to dehumanize people, like whether it's the kids, the parents. And Adam, like knowing you, and the thing I love about you the most is just how much you love being an educator, how playful you are. You know, at lunchtime, you go out and hang out with the kids. Like, you're a highly engaged person. And if I started to see you drifting away from that, or, you know, really like your self, what you were saying is, where you start to really attack people and show a lack of empathy, that would be a sign. Does that make sense?
Yeah.
And I think
Yep.
I might add to that, if that's okay, to the Adams. If you find yourself drifting away from your personal relationships as well, because it's too much to hear how your partner's day is or how your kids are going and things like that, that's another warning sign. What I always tend to say is, because a lot of people can feel a lot of shame if they are experiencing compassion fatigue. And I think it's so important to just meet yourself where you're at and recognize that this is actually a protective factor, almost like that you are overwhelmed and that you have been dealing with too much with not enough support for too long, so that internally we do have a tendency to switch off. And so that's coming from a place of just trying to keep you safe. So just always come and meet yourself where you're at and just try your best to show yourself some compassion if you're really struggling.
Yeah. And one thing I will say, Adam, is just make sure you take decision fatigue. That's very different to compassion fatigue. So decision fatigue is a real thing. Like, the more decisions you make, like throughout the day, it starts to wear on you, but that's very different to compassion fatigue.
Yeah, and I know definitely, like in my role, like, and we're a pretty dynamic school of sort of 450 to 500 kids, and so you get hit, but then when you do have those and you are presented with some of those mental health challenges from others outside, what I have found is that actually wears down, and exactly what you guys were just sort of saying around where you dehumanize and you just move on to the next bit without actually, like, and I love Adam's third space. I've got it on my wall around just being able to sort of say that if I move from one thing to the next without actually trying to filter that, and I know towards the end of last year, I wasn't filtering, like you just jump because you go, right, I'm here, without actually taking that time to decompress on what you were saying, Chloe, around just how do we make sense of some of that. So I think, I love the work in which you guys are doing. And I think the more that we can do this for principals and for us, and the work that Mark's doing is can only help us as a profession.
And Adam, if you want some specific takeouts from this as a leader, what can you do? Number one is read the report. Now, we released a preliminary report. We're now releasing a report that has all the strategies that we've discovered. So out of those 107 interviews, we identified the people who had really high exposure to secondary trauma, but really low STS. And what we've done is coded what they did. Now, one thing we are not saying is that this is an educator's problem. Like, we've given a lot of recommendations around systems, around education departments, about what they can do. But we've also got recommendations for what can the leader do, the school. What can you do as a colleague? Like, how do you be a good colleague? And
Adam,
also,
Adam, if I can just jump in there, we're just about to run out of time, and I wanted to make sure that you were just able to quickly wrap up
okay, cool.
the things to do as a leader, because we're just
about. So read the report. acknowledge that this is an issue and start to talk to people about it and ask them, are they experiencing this? Be mindful of it. Whenever someone talks about it, don't get them to relive the trauma, but focus on, well, how can I support you? Name and validate their emotion and literally ask them, what does support look like in this moment? What can I do for you right now? What would be most helpful? So in terms of, as a leader, but as I said before, in that report, there are tons of strategies that you can start to implement and take on.
Absolutely awesome. Thank you. I knew when we had this subject matter scheduled that we could probably talk about it for a couple of hours and still not cover everything. But I want to really thank Dr. Chloe Kidd and the two Adams for being part of this wonderful discussion. So much more that we could explore, and we might have to get you all back for round 2 at some point. But thank you again. Thanks for everyone for being part of today's session.
Thanks for inviting us.
I'll hand back to Brendan.
Thanks, Morris. Yes, thank you to the presenters and everybody for joining us today. Reminder that the survey poll is in the chat box there, so please complete the survey before signing off today. Today is the final session in the autumn series. Our next sessions will be in the winter. The winter series starts on the 11th of June. Topics in the 4-part series will include teaching in multi-age settings, change management, risk management with a focus on school councils and student agency. Some very important topics which I would encourage people to enrol in. So thank you everybody for participating today. Bye for now.
Brendan, hang on.
Yes, Mark.
Sorry, last minute thing. Adam Fraser's team tell me he's terrible at self-promotion, so I'm going to do it. The Flourish Movement podcast just hit 30,000 plays, which is amazing. So congratulations on that. And I would strongly encourage anyone, if you haven't listened to the Flourish Movement podcast, to get on board.
Especially Adam Downs' episode.
That's it.
Thanks, Mark. Thanks everybody.
Guys.
Bye for now.